Pageant Queen Mariyam Konneh, na founder of Mariyam's Ways Foundation, don say awareness and education key for wellness and say it important for the woman them understand their own body. It talk this na one menstrual health hygiene conference we happen Wednesday, May 28th, na Radison Blu Hotel inside Fritong, where it be the talk na the conference about menstrual health awareness for mark the celebration of Menstrual Health Day. Mariyam Konneh, when have been the first runner-up for Miss Sierra Leone 2025, share in personal journey and say, na out of curiosity bring them to the knowledge of teen them where gets for do with menstrual cycles and hygiene.
But today, we are going to do it different. My interest in this whole feminine hygiene awareness didn't start with a tragic story. It's not. It's out of curiosity. I've always been the most curious girl in the room. I always want to know things. Even during my teenage years, I used to ask my mom lots of questions. Mommy, what to make I make so? What to make this don't do me so? Why are the meds past 1 week? Is it normal? So it was a lot to my parents. So all the things I got to learn were out of curiosity because I wanted to know more. Because at a very young age, I got to realize that my femininity is something I own. It's something that makes me so powerful. Our womanhood is something so delicate, and if only we know how much power we possess, then we'll have more interest in talking about these things. So I decided to do this conference as the push for the right thing to be done.
This 20-year-old used the event for officially launch the Mariyam's Ways Foundation. It said the foundation there for empower women them health and address different wellness issues them.
I also want to use this opportunity to officially launch the Mariyam's Ways Foundation. This foundation is dedicated to holistic wellness. My team and I believe that for an empowered person, for you to be an empowered person, you have to have an empowered mind, an empowered body, and most importantly, you should come from an from a healthy community.
Gynecologist Dr. Salmadu say for neglect menstrual hygiene go lead to serious health issues, and stress say open conversation about menstrual cycles go increase awareness and encourage better self-care.
But that's not hygienic because you have to change your pad 3 times a day or maybe twice a day. If you're not supposed to also because some people they bleed very heavily. Within 1 to 2 hours, they don't flop the entire pad. So they get regularly they change your pad. Okay, it's not hygienic to leave your pad on for more than 6 hours. Even you said they may talk to them, that pad will not take for long. They feel uncomfortable. They feel like they sweat, they become irritating. Then they show say yes, same knowledge for changing pad. And this will make it they begin smell. Oh my way they smell, you know. Now you force it pick them up. As you sit down, so they begin put that foul odor. They begin wash first. But they know say there is something wrong. And then because you don't left the pad on for a very long time. And bacteria they grow inside blood, just so you know. So if you left the blood there for a very long time, it encourages bacterial growth, it will lead to infection. Okay? So that pad they make people they change every 4 to 6 hours.
Dr. Frances Ramatuwuri emphasized the importance of advocacy in our schools and homes because, according to Ram, that's now one way for stop the stigma we surround menstrual cycles. If women then value them body and take them wellness seriously, it said they will give back to the community in different ways.
But these are the things that are important to also have open discussions about. It starts with each individual. Wherever you are, wherever you work, wherever you go to school. Because it's not going to be a thing of, oh, we want government to do so. What are you doing? It starts with you. You're the woman. So I remember somebody was talking about vagina and vulva. Do you know how many women come in and they're like, me vagina? Like, you can't even see it. It's not even something you can see. So you can't be telling me vagina they this, me vagina they that. You can't, what you see is a vulva. So it starts with you. Know your body. Know what's your normal, because everybody is different in so many ways. Know what's your normal so that you know how to ensure that you can speak up for yourself.
As discussions wrap up, stakeholders then commit for increased awareness, advocacy, and policy development for promote menstrual health and tap the stigmatization across Salone. Reporting for Slick TV, me na Paulina Baindu Samba.